Hello, my name is Ann Vickery. I am a mental health educator with the Canadian Mental Health Association, York Region, South Simcoe. And the presentation I'm going to be providing today is the Workplace Mental Health Series for managers and supervisors. And when we look at mental health, we define mental health as the capacity of each and all of us to feel, think, and act in ways that enhance our ability to enjoy life and to deal with the challenges that we face. It is a positive sense of emotional and spiritual well-being that respects the importance of culture, equity, social justice, interconnections, and personal dignity. And we know that statistically, mental health is the #1 cause of disability claims in Canada. So when we talk about mental health, we know that there's a lot of stigma surrounding mental health, and often we prefer to use a term called mental health problems. So mental health problems are really a broader term that include both mental disorders and symptoms of mental disorders, which may not be severe enough to warrant an actual diagnosis of a mental disorder. So in the workplace, we realize that there are a lot of challenges that workplaces deal with mental health. It's almost like it's the pink elephant in the room, and people often don't know how to deal with mental health challenges. So one of the biggest concerns from a supervisory and managerial perspective, when you observe that you have an employee who is exhibiting behaviors that are different than their baseline, often the first go-to is asking yourself, is it a performance issue or could it be a mental health issue? And only 36% of employees would actually discuss with their supervisor if they had any symptoms of a mental health problem. 2 out of 3 are not seeking help. There's a 60% drop in family income when primary income earner is diagnosed with a mental health problem. And statistically, 1 in 5 Canadians will experience a mental health problem each year. 1 in 3 Canadians will experience a mental health problem in their lifetime. And statistically, we know that 500,000 Canadians miss work every week. So many people and leaders are left assuming that the issue is someone is having a performance problem. And based on the information immediately available, that's understandable to assume that it's a performance problem. After all, most people wouldn't talk to their supervisor about their mental health problem. In fact, most people won't even talk to anyone about their mental health problem because of stigma. And as a result, these problems very often go unrecognized and unaddressed until much later, if at all. And the situation can become more complicated than they originally needed to be, and the impact on both the individual and the workplace can be absolutely profound. We know that 2 out of 3 don't seek help because of stigma. And stigma is defined as discrimination, as bias, as prejudice. And we know that because people feel as though they would be perceived in the workplace as weak, as not promotable, often they will try and push through their symptoms and wear a mask and try to deal with their issues in the workplace. But often supervisors and managers start to observe behaviors that could be the sign of a mental health problem. And that's really why I designed this program, was to give managers and supervisors tools to really address and deal with some of these issues that they may see in the workplace. When we talk about statistic 1 in 5 Canadians, or even the 1 in 3 statistic, realistically at Canadian Mental Health Association, we think that statistic is actually skewed. We think it's more like 1 in 1 Canadians will experience a mental health problem in their lifetime. Or even in a given year. And the reason for that is that our high stress work environments have a tremendous impact on the mental health of your employees. People don't just deal with stress in the workplace, they also have stress in their private lives. And we know that when stress is layered over various events and people are dealing with major change in their life, that can often trigger some of these mental health problems in the workplace. And so this course is really designed to help managers and supervisors deal with some of these issues on an ongoing basis. So I'm just going to take a few moments in the next slide to talk about what the program has available. I've designed 6 different modules that are available to organizations to deal with some of these issues. And the first 2 actually, I've designed specifically for senior management. The first one is Module 1, which is the financial impact of workplace mental health problems. The second module talks about the national standard for psychological health and safety in the workplace. Module 3 is identifying mental health problems in the workplace. Module 4 is the accommodation process. Module 5 is bullying in the workplace. And Module 6 is managing stress in the workplace. Now, Module 3 to Module 6, typically organizations book that session for middle management and supervisors. Those 4 modules can be combined into an 8-hour training, or we can customize them to suit the time frame and parameters depending on what the organization is looking for. So I'm just going to take a few moments to summarize some of the topics that we cover in each of these modules in more detail. So in Module 1, where we talk about the financial impact of mental health problems, statistically, we know in Canada that 30% of all disability claims and 70% of costs are related to mental health problems. $51 billion annually is lost in productivity in Canada. The average cost due to mental health disabilities for an employer is $18,000 for an average of 67 days of absence from the workplace, and this is for benefits only. That does not include overtime costs, the cost for other employees to pick up the extra workload, and it also does not cover the cost for managers to pick up the extra workload when an employee is off on disability. And just in comparison, the average cost for a physical disability is half that amount, $9,000, and an average of a 30-day absence from the workplace. 82% of businesses that responded to a national survey ranked mental illness in their top 3 reasons for short-term disability. 72% of businesses ranked mental illness in their top 3 reasons for long-term disability costs. Direct employer costs are estimated at $2.97 billion in Canada and a total cost of $11 billion. So the costs are insurmountable. We also know that based on a Statistics Canada survey, that lost productivity from presenteeism was at least 7.5 times greater than productivity lost from absenteeism, and that it is estimated that presenteeism costs Canadian businesses $15 to $25 billion per year. And presenteeism is defined as when an individual is dealing with a mental health problem and they do show up for work, but they just sit in their office or they sit at their desk and they absolutely are totally unproductive and they can't function in the job, but they show up for work, versus absenteeism. In this module, we will provide managers with a better understanding of the financial impact of mental health problems in the workplace and the financial implications on an organization that does not support work-life balance of their employees. We'll go into a lot more detail about the different aspects of the impact financially for an organization. So when we look at Module 2, we cover the National Standard for Psychological Health and Safety in the Workplace. And the National Standard for Psychological Health and Safety was launched by the Mental Health Commission of Canada. And it is a voluntary standard at this point. But the standard is really designed to help workplaces to address psychological health and safety in the workplace. And we know that claims for mental injury in the workplace have increased 300% in the last 10 years. And we know that 70% of Canadian employees are concerned about the psychological health and safety in their workplace, but 14% of Canadian employees do not think that their workplace is healthy or safe at all. So the benefits of the standard include reducing stigma. We know that stigma is a huge barrier for people to seek help when they are struggling with a mental health problem. The standard is designed to reduce stressors in the workplace and to identify what sort of stressors exist in the workplace. It enhances productivity. It improves risk management for an organization. It improves employee retention. It also has a sense of corporate social responsibility, and it also increases organizational recruitment. The purpose of the standard is to prevent psychological harm due to conditions in the workplace. and it's to promote psychological health in the workplace through support. 4 main areas of consideration that make up the business case for improving workplace psychological health and safety is risk mitigation, cost effectiveness, recruitment and retention, and organizational excellence and sustainability. Research has shown that those organizations that implement the psychologically health and safety workplace strategies are on average better performers in all key performance categories, from health and safety to key human resource measures to shareholder returns. And in this module, we provide managers with an overview of the standard, and we help them to identify workplace factors that can affect workplace psychological health and safety. In Module 3, we help managers and supervisors to identify mental health problems that they may see in the workplace. And this isn't about teaching managers to diagnose or to be clinicians, but it is to be able to identify behaviors that may be a change from the baseline that they know that individual normally behaves from. And these are some of the common misconceptions that we see workplace managers and supervisors have. That if they see someone with a behavioral issue, they assume they have a bad attitude, they're a difficult person, they must have a character flaw, they must be hard driving, they're annoying, they're moody, maybe they have a personality defect, maybe they're obsessive, maybe they're lazy. And so often people who are experiencing these mental health problems are being perceived inaccurately. So it's important that managers and supervisors know how to recognize perhaps the early signs of mental health problems in the workplace, and then provide early intervention so that you can prevent problems from worsening and potentially leading to costly disability leaves. Depression in the workplace, we know that it can have a serious impact in the workplace. It can lead to errors and accidents on the job. It can lead to morale problems on a team. It can lead to lack of cooperation and increases in conflict. It can affect safety issues. It can lead to more absenteeism and presenteeism. And it can also lead to substance abuse as far as alcohol or drug abuse. And a 2001 study found that depressed individuals were twice as likely to miss work than non-depressed people, and were 7 times more likely to have decreased job performance. People with depression missed an average of 4.8 workdays and suffered 11.5 days of reduced productivity in a 3-month period. So it's important to provide early intervention and identify these potential issues in the workplace that could result in employees who are experiencing depression, such as a high-stress environment. Depression is a serious neurological illness. It can result in neurocognitive impairment. And neurocognitive impairment refers to thinking skills such as attention, memory, information processing, and problem solving, which can result in poor work performance as well as feelings of inadequacy. So in this module, we help managers to identify early indicators of mental health problems, understand the symptoms of depression, symptoms of anxiety and bipolar disorders, and substance abuse, as well as how to respond to employees who may be experiencing a mental health problem and direct them to the resources that could help them. In Module 4, this focuses on workplace accommodation, and we understand that in a lot of workplaces, typically managers and supervisors don't manage the entire accommodation process. However, it's important for them to understand how the process works and to perhaps implement strategies at a micro level to accommodate an individual who requires accommodation. Organizations in Canada have a legal duty to accommodate employees, whether they have a physical disability or a mental disability. And we find that in the workplace, attitude can be the biggest barrier to people being treated with respect and dignity in the workplace when they are requiring accommodation, or when they return to work. How they are treated is often a big effect of a negative attitude. And there's something called ableism, which is defined as the tendency to see people with disabilities as less worthy, as underestimating their potential or excluding them from decisions that affect them. So it's important for supervisors and managers to be well informed about the accommodation and return to work process. And when supervisors are left completely out of the return to work planning process, they feel ill-equipped to accommodate returning employees. We know that recovery is possible for folks who live with mental health problems. And so when people are returning from disability, it's important that they are treated with respect, treated with dignity, and that workplace supervisors and managers come from the perspective of expecting a successful return to work as opposed to expecting problems and difficulties, which can have a huge impact and even hinder the recovery of those individuals returning to work from a mental health problem. Some of the key issues in dealing with accommodation include who's going to take on those extra tasks until the accommodation period is over. Where can the employee work? Can the tasks be modified? What's your follow-up plan? How are you going to manage coworkers' concerns? And how will you take care of your mental health as a manager and supervisor? And we know that it's important that how that person is treated when they return to work has an impact on the health of that employee. And any conflict or any adversarial approach can worsen the health of that employee and their mental health problem, such as depression or anxiety. So it's really important in the workplace to maintain a collaborative and cooperative relationship. So in this module, we help managers to identify challenges that could in providing accommodation. We help identify situations that could require accommodation. We discuss key strategies to facilitate successful return to work processes and to demonstrate improved communication during the accommodation process. Module 5, we talk about bullying in the workplace. And we all can remember the days when bullying in the schoolyard, and we know what that looks like. But bullying in the workplace is very, very different. And a lot of workplaces don't want to acknowledge that it exists in the workplace. But statistically, we know that 40% of Canadians have experienced bullying in the workplace. And that statistic is probably skewed because that only includes the people who have actually come forward and reported bullying in their workplace. Bullying is a serious issue. It affects the overall health of an organization. And we know that 62% of employers actually ignore workplace bullying. We know that even if someone does report bullying, at least 11% of organizations rationalize that behavior, and it can negatively affect the entire health of an organization. So in this module, we talk about what does bullying look like? What are some of the signs of bullying? How does bullying affect the individual? How does it affect the workplace? And bullying and harassment is an issue that poses a potential risk to the physical and mental health and safety of the workers. It can lead to lower productivity, physical illness, increased risk of injury if someone is distracted while performing work tasks. It can lead to serious illnesses such as debilitating anxiety, depression, and post-traumatic stress disorder. And at the Canadian Mental Health Association, we define bullying as repeated and persistent negative acts towards one or more individuals which involve a perceived power imbalance and create a hostile work environment. In Module 6, we address the issue of stress. And when we talk about stress in the workplace, we know that there are many workplace wellness programs, exercise programs, gym facilities that are available to employees. But in this module, we'll really look at what are some of the sources of stress in your workplace, and actually not only how to helping you to help your employees manage stress, but also discussing some strategies to actually reduce stressors in the workplace. And there are 6 key stressors that are sources of stress for the average employee. And stress has a costly impact on any organization. The average direct cost of absenteeism is $3,550 per employee per year, and according to a Watson-Wyatt Canadian Staying at Work survey. There are also many other hidden costs associated with staff who are suffering from stress, such as lack of commitment, high staff turnover, costly mistakes, and poor customer service. Work-related stress is a growing problem around the world that affects not only the health and well-being of employees, but also the productivity of organizations. And we know that workers with a high degree of stress, balancing their work and family life, missed 7.2 days of work each year, while those with very little stress missed an average of 3.6 days per year. And it's important that managers be alert for the signs of stress amongst their staff. Identifying the signs of stress at an early stage increases the possibility that action can be taken to deal with the symptoms and the underlying causes, thus minimizing the risk to that individual's health and well-being and the effects that it could potentially have on the organization. Chronic stress is a definite causal link to depression. Chronic stress can make someone mentally ill. What it does is chronic stress actually increases the cortisol hormone released in the body. And that cortisol hormone can actually cause the hippocampus and the amygdala in the brain to atrophy. It can also reduce norepinephrine, dopamine, and serotonin levels in the brain. And those three chemicals are important chemicals for maintenance and stability of mood. So if you have chronic stress in your workplace, employees who are exposed to that on a daily basis could over time start to develop the symptoms of depression. In this module, we help supervisors and managers to identify the signs of stress, we identify the major workplace sources for stress, and then we provide some strategies to minimize and manage stress so that the potential for people who are susceptible to depression is lessened by reducing the stress. So finally, when we look at the mental health series for managers and supervisors, some of the benefits for the organization include higher job satisfaction, more attachment from employees to their work, higher performance, improved attendance and productivity, more effective accommodation and return to work processes, enhanced team learning behavior, interventions focused on the prevention or treatment of mental health problems that have produced a favorable ROI, but also, perhaps more importantly, improved VOI, improves employee retention and recruitment success, and reduces disability claim costs for an organization. So when you think about your workplace, when you think about considering this type of a workshop, if you look at this spectrum, in the middle of that spectrum is a workplace that has balance. And you need to ask yourself, is your workplace in balance? Are your employees productive? Are they engaged? Are they healthy? Are they open to change? Or to the left on that spectrum, are they unmotivated? Are they oppressed? Are they dispirited? Are they drained? And at the very far left, has it reached a state of crisis where it's a toxic work environment? People are starting to experience burnout, more injuries, and more incidents. On the other side, on the right side of that spectrum, are people more stressed? Are they being overworked? Are they scattered? And are they tense? And at the far right of that, again, has that reached a crisis point where the work environment has become toxic? People are experiencing more work burnout, injuries, and incidents. We have delivered this training since the launch in January of 2016 to all of the leadership, including the president of Markham Stouffville Hospital, all of the chief of staff, all the medical chiefs of each department, every team leader at Markham Stouffville Hospital. This training has also been delivered to every management level at the town of Richmond Hill, including the CAO. And I am currently offering this training to all of the senior command and management level and supervisory level for York Regional Police. This training has had exceptional response, and we are seeing tremendous changes, and all of these organizations have actually made this training mandatory on an ongoing basis for their employees because of the value they see from this training. If you are interested in learning more about it, or you'd like to book a workshop, please call 905-841-3977, extension 2211, and Carol Lever will be happy to answer any of your questions. Thank you.